limb for the Somso muscular series. To begin, we can see the adductor magnus right here. The gracilis is the most superficial and medial of this group right there. And then here is the adductor longus. The adductor brevis is not shown on this model. It would be deep to these muscles. We can see the pectineus right up here, really small muscle. And then here is the longest muscle in the body. This is the sartorius. So we're originating over on the anterior superior iliac spine and passing all the way over to this medial portion of the tibia. If I remove the sartorius, then I can get a look at the quadriceps group. So the quadriceps group is made up of the rectus femoris. This is going to be the biarticulate muscle of the group. It's passing across the hip as well as the knee. So I'm going to just remove this rectus femoris. So rectus femoris removed. Now I can view underneath here the vastus intermedius, the vastus medialis, and the vastus lateralis. So those all insert into this common patellar tendon that would go on to insert to the patella, and then further down the patellar ligament inserting into the tibial tuberosity. So that is a group of knee extensors. The rectus femoris works with that group on knee extension, but it is also a hip flexor because it passes over the hip. Over on this lateral side, this is the muscle of the tensor fascia lata. So down here, this is the iliotibial band, and this is going to be a flattened tendinous sheath that would actually extend to a covering of fascia that would cover the entire muscle group on the thigh. Moving to the posterior side here, this is the gluteus maximus. Just superior to that is going to be the gluteus medius, or superior and also deep to that is the gluteus medius. Then we have the 5 muscles that are considered to be the deep external rotators of the hip. So this is going to be the piriformis, the superior gemellus, the obturator internus, the inferior gemellus, and the quadratus femoris. So this is an important group of muscles. One of the main reasons is that the sciatic nerve actually passes deep to the piriformis, and it passes superficial to the superior gemellus. So sciatic nerve is the largest nerve bundle in the body, and it passes right through that area. Here we can look at the hamstring group. So the hamstrings are made up of, on the lateral side, the biceps femoris long head. Deep to that is going to be the biceps femoris short head. And then here we have the semitendinosus and semimembranosus shown deep right there. Now, looking at this, this is actually the adductor magnus right there. On this posterior side, we have the muscles that are called the triceps surae, and this is made up of the gastroc medius lateral head, gastroc medius medial head, and then the soleus, which is viewed deep to that. We can also see the plantaris right there. Then here we're viewing the popliteus, the tibialis posterior, and then these two down here actually will cross over on their journey out to what they're working on. So these are both flexors, and this is actually going to be the flexor hallucis longus, and then this one is over here is called the flexor digitorum. So here on the lateral side is the fibularis longus. It also can be called peroneus longus. And then deep to that, and also more inferior, is going to be the fibularis brevis or peroneus brevis. On this anterior side, we have the tibialis anterior, and then we have the extensor digitorum right there, and then deep to that, we have the extensor hallucis.